All right, we are rolling on Wisconsin Family right now from Dr. Joe's Acupuncture and Wellness Clinic, and we are joined right now by Alex Vang, and thank you so much for joining us. He is with Pinpoint Diagnostic Soundwaves Imaging, which is a bit of a mouthful, and so we want to make sure that everybody knows, basically what you do. And so, what role basically does your business serve for the community?
So, this is such a long. Where we just go by PDSI. You can just say PDSI.
Thank you.
Okay, yeah, that's much easier. Yeah.
So, the role my business serves for the community is we are a diagnostic ultrasound specialist. And when I say that is because when people have problems, say if you have problems with your plumbing, you call a plumber. You have issues with roofing, you call a roof company. And so what you're able to do is you're able to go online, look up the companies and see what's affordable and accessible, because you want something right away and you want to know what the price range is.
Right.
Well, right now you don't have that option with diagnostic ultrasound services, and so we solve that problem because we are a diagnostic specialist that specialize in providing these care, and so we offer these prices, so you know what you're paying for, and it's accessible, and so you're able to, or people are able to shop around for this problem.
Interesting. And I've actually gone through that where I've tried calling the insurance company, and you have to talk to the doctor's office to get the codes to figure out how much something's going to end up costing you. Yes. And here you just got it right on your website. So that's got to be one difference. What are some of the differences in using your services versus using a referral from your provider?
So our services, we save people 40 to 60% off their traditional medical bill. And on top of that, we provide a copy of the client's report and their ultrasound images. And we're also flexible to open schedule appointments on Saturdays. And the reason why we're able to save 40 to 60% on these medical bills is because of our business model, which is a self-pay business model. We don't bill through insurance. And so when you don't bill through insurance, you're able to offer a flat rate for your service here. And that's where the huge saving is. And that's why we emphasize about, we emphasize empowering people to be able to have the choice to choose their costs and their care.
Wow. Mm-hmm. So you've got a very transparent business model. So you know what you're getting into, you know you're going to save money, and you explained that it's self-pay. But can you explain a little bit more about what that means and what that might look like for the person who is needing the service?
Yeah, so there's a few articles right now that's surfacing out there. So along the East Coast here, there's been an innovation, a push for healthcare because of the high healthcare costs. And so you have providers, healthcare clinics that are shifting away from billing through insurance companies and doing like a membership services. And one business model that is called direct primary care. Now, direct primary care is like a membership kind of service where you have unlimited access to your provider via telephone, email, and they also offer you resources in their network so that you can get these kind of services at a cheaper rate. So if you go to a hospital and say you're getting a blood work and it's like $40-$30, well, they have the resources to get you that same service for about $3-4.
Wow.
And so it's a huge cost saving. And in fact, there's a doctor called Dr. Henke's of Advocate MD. She's going to be opening up a practice here in January, and so it is a direct primary care business model. So my business model is similar to that in that we don't bill through insurance, but we pass all that savings and focus back onto the patients on their health and not the cost.
I think I've heard of dentists doing this membership kind of thing too, if you don't have dental insurance.
Right.
Yeah, pretty neat stuff. And what also is neat, we take the history, the scope of medicine, and now ultrasounds are basically a relatively new concept and idea. How else are people using diagnostic ultrasounds?
There's been a big push in the society, in I guess, nowadays about preventative and wellness. Everybody's very health conscientious and stuff. And so ultrasound is a great tool to kind of pre-screen for certain conditions, whether you have high blood pressure, cardiovascular disease. You can pre-screen your arteries to check if there's any plaque buildup to kind of, get the early treatment. So, in a way, we always say that's like getting the baseline of your anatomy structure. You're saying the same thing for your organs. So how do you know if you're overweight? You have to get on that scale, and you gotta kind of figure out where you're at. That's the baseline. And because ultrasound doesn't use radiation, it can be used to kind of get that baseline for people who don't know where they're at and they want to be healthy and health conscientious. Or if you already know that, your family has these conditions, maybe you should get it screened just to kind of make sure that you're catching it early so that you don't fall on that road where you're stroking out or having a heart attack.
So those are some good guidelines if you're wondering whether you should come in and have an ultrasound done, some of the family history and that kind of thing. Any other reasons? And then how do people get started? And we have just a few seconds left.
Right, so, obviously when you're a physician, when you call the nursing line, people are having these problems and pain, they're gonna call the nursing line, they're gonna talk with the physician. If they say you need an ultrasound, just say, hey, can you refer me to PDSI ultrasound? So I want to save 40 to 60% off on my medical bill.
Who doesn't? Yeah, saving money on medical bills, a great thing to
It
have.
is. Otherwise,
right
just give
now,
us a call too if you have any questions there. We'll be I'm more than happy to answer anybody's questions.
Excellent stuff. Alex with PDSI. We're back for more on Wisconsin Family right after this.